Hello and good morning. I'm testing out the latest and greatest in upgrades we've made so I can both publish and answer more questions and go online and interface with more folks who have questions and need answers. First of all, I'm Dr. Sharma. I'm part of ARIA Wellness Center here in Silver Spring, Maryland. We are a medical marijuana state, and I am here to basically go over topics and information. I try to do this every day, every couple days, based on questions that I've run into and interesting new studies and stuff that may help a lot of folks, avoid trouble and hopefully do well. Medical cannabis is a way to not only treat, but to kind of help control a lot of really not so nice symptoms. Most literature will suggest that cannabis helps with persistent nausea, helps with muscle spasms, helps with chronic pain, helps with cachexia or wasting syndromes. The side note that a lot of us clinicians note when we have patients using cannabis is there's also relaxation, better sleep, and a lot of secondary gains that people get from the use of cannabis as medication. So I wanted to share that with you guys, as well as if you have questions, please feel free to send them to me, email them to me, message us here at the clinic. Our email address here at the practice is ariawellness@greenlotus.center. Our website is also called greenlotus.center. The Facebook page is ARIA Wellness Center. And if you need any other way to get a hold of us, there is a 877 number. It goes 877-862-0303. My scheduler is located on option 3, and that should save you time. So the topic I wanted to go over today was the cannabis hyperemesis syndrome that folks out there have heard about, probably maybe have even seen a friend or someone go through this. It's not a fun one, but it's a syndrome that happens. And the usual scenario is heavy cannabis use, young adult male, persistent use for many months and many days and many hours in a row. And what eventually happens is this recurrent episode of projectile vomiting. What's reported in that literature and our case reviews are that when folks go through the cyclical vomiting syndrome, eventually it gets to a point where they seek medical attention. The areas we see these folks interface with the medical establishment is in emergency rooms. So it's very common for us to find folks with cannabis hyperemesis syndrome interfacing with emergency departments. Subsequently, what our studies have shown and suggest, it's kind of interesting. There were 2 studies done. One was down in Australia. The other was up here in the United States in Minnesota at Mayo Clinic. And both of them did reviews of a lot of these cases that were coming in with cannabis and hyperemesis. So A, this is something to try to avoid, and B, there was a lesson behind all this that we've kind of inferred medically. So what we can see from the data was these folks came in, same symptoms, persistent vomiting, projectile vomiting, uncontrollable abdominal pain and vomiting. When they stopped consuming cannabis for a 30 to 45-day washout, the syndrome stopped. So in both studies, 6 of the 10 patients quit cannabis for that period of time. And subsequently, a portion of them were able to resume cannabis use without complication. The folks who persisted and continued to use cannabis reported that the only thing that gave them relief from the abdominal pain and the projectile vomiting was a warm shower. So there are several kind of things we can conclude by kind of reading into this study. One is there's a washout period for the hyperemesis that takes place, or this vomiting syndrome. That washout period is somewhere on the order of 30 to 45 days. And it makes us kind of think or wonder, if there's something deeper going on that we should be aware of. The deeper thing would be, is cannabis, cannabidiol, and these medications absorbing into cerebral fat or into the nervous system in such a way that it causes this temporary toxicity. Now, note this doesn't happen to a lot of folks who are just using this to treat pain with microdoses or low dose therapy. This is chronic, persistent, heavy use that we see this in. So, number one, it can happen in that scenario where there's chronic, persistent use. Number two, quitting and abstaining for about a 30 to 45 day washout results in resolution in most of the cases that they studied. Three, there's probably a reason for this. And from what we can gather, if this is building up, since it's an oil that we're talking about, and it's building up to toxic levels or proportions, then we just have to be mindful of the amount that's being consumed. And we have to be mindful that, chronic persistent use can lead to trouble. So it's something to watch out for. If you have a friend who has any issues with this, we're always willing to consult, see them, help them out. Yes, a lot of folks who get to the extreme margins of vomiting many days in a row with severe abdominal pain will end up in emergency room. Some of them will need some IV fluids. So our goal is to educate and help folks avoid this problem. So once again, if you need us, I'm Dr. Sharma from Arya Wellness Center. We're always here to help educate. Education should be free and available everywhere. We thank Facebook for creating this platform where we can go live and share this information. So once again, if you think this content's important, you want to spread it out for us by sharing this. We appreciate that. Please share this quick video. Please feel free to like the Arya Wellness Center page. Please look us up on Instagram, and please find us on Pinterest. Like I said, we just want to be available and help folks out there who need us. And thank you for tuning in. Have a good day.